Hello, and welcome to Talking with Patients about PARP Inhibitors for Breast Cancer, presented by the France Foundation. Poly-ADP ribose polymerase inhibitors are relatively new therapeutic agents for treating some cancers, including BRCA1 and BRCA2 mutated breast cancers. PARP inhibitors work by interfering with the DNA repair process of tumor cells. Because DNA breaks cannot be repaired, this leads to death of the tumor cells. There are currently 2 FDA-approved PARP inhibitors for patients with metastatic breast cancer. Olaparib, also called Lynparza, is indicated for patients with deleterious or suspected deleterious germline BRCA-mutated metastatic breast cancer who have been treated with chemotherapy in the neoadjuvant, adjuvant, or metastatic setting. Patients with hormone receptor HR-positive breast cancer should have been treated with a prior endocrine therapy or be considered inappropriate for endocrine therapy. Talazoparib, also called Talzenna, is indicated for patients with deleterious or suspected deleterious germline BRCA-mutated HER2 negative locally advanced or metastatic breast cancer. When discussing PARP inhibitor treatment with patients, there are a number of topics that should be reviewed. Diagnostic testing is used to confirm appropriate patient population for the use of PARP inhibitors, namely adults with deleterious or suspected deleterious germline breast cancer susceptibility gene BRCA mutated locally advanced or metastatic breast cancer. Olaparib and talazoparib are oral agents taken with or without food. The Olaparib dose is 300 milligrams, 2 150 milligram tablets, twice daily, about 12 hours apart, and should be swallowed whole. The talazoparib dose is a 1 milligram capsule once daily, and capsules should be swallowed whole. Both Olaparib and talazoparib can cause fetal harm to a pregnant woman. Therefore, highly effective contraception is extremely important for women of childbearing age or potential. Blood tests will be conducted to check blood counts at several time points: before starting treatment with a PARP inhibitor, every month during treatment, and weekly if low blood cell counts last a long time. Overall, PARP inhibitors are generally well tolerated. Some common side effects associated with Olaparib include nausea or vomiting, low number of red or white blood cells, stomach area pain, tiredness or weakness, diarrhea, joint, muscle, and back pain, changes in the way food tastes, indigestion or heartburn, and loss of appetite. Some common side effects associated with talazoparib include tiredness or weakness, low number of red or white blood cells, nausea, low number of platelets, headache, loss of appetite, diarrhea, vomiting, and hair loss. Patients should be encouraged to contact their healthcare team for medical advice about side effects. In some situations, dose adjustment may be recommended for patients having difficulty with treatment-related side effects. Treatment with PARP inhibitors may cause serious side effects, particularly myelodysplastic syndrome, MDS, or acute myeloid leukemia, AML. Patients should tell their healthcare team if they experience any of the following symptoms during treatment: weakness, weight loss, fever, frequent infections, blood in urine or stool, shortness of breath, feeling very tired, bruising or bleeding more easily. Clinical studies with Olaparib and talazoparib have demonstrated significant improvement in progression-free survival compared with standard therapy. These agents have expanded the treatment options for patients with BRCA-mutated breast cancer. Additional agents in development for patients with breast cancer include Veliparib, Niraparib, and Rucaparib. Thanks for joining us to review the important information to be communicated to patients about PARP inhibitors.